Hi, this presentation will look at the issue of family planning and women's rights in the context of population policy. Since World War II, both population and development have been viewed as intertwined, and a major focus with regard to the population side of that has been on fertility, as it's so consequential for population and for economy, and family planning has been the central strategy. 1946, the UN created a population commission. A few years later, International Planned Parenthood Federation was created, and international efforts towards family planning were underway. The World Population Conferences, which have been meeting since the 1950s, have not always positioned family planning at the heart of things, and when they have not always done so with the goal of empowering women. As you can see, going down this little brief discussion of what each accomplished, it's not until 1994 that the importance of women's social and reproductive rights came into play. Historically, practices of population control have been controversial. Women have had to undergo forced sterilization. Of course, there has been eugenics, and the Nazis forced abortion. Controlling access to contraception and family planning has been a major problem in the United States as well as other places, as we'll see when we review the history of family planning. That the agency of women has routinely been denied, and policies have always been coercive. And they've been less successful than those policies that have been more empowering of women. And so future policy should embrace a turn towards respecting the autonomy and agency of women, not just because it's the right thing to do, but because it has been more effective at controlling fertility. The field of demography, incidentally, has not really kept pace with this trend in terms of studying the need for greater emphasis on gender. A study by Williams in 2010 found that, for instance, only 5% of the sessions at the 1999 Population Association of America meeting discussed gender. In 2008, the journal Demography published only one article on gender. And so generally the field of demography has had little engagement with feminist theory or with ideas promoting gender equality or the empowerment of women. Now if we look at the history of family planning, it goes back to Francis Place, who's considered the father of family planning. He was in disagreement with Malthus on the inevitability of population crisis and collapse, and also on the question of the moral use of contraception. Place was in favor of it. Charles Knowlton wrote an influential book in 1832 that was subsequently reissued in other countries. So Knowlton was a pioneer in the spread of knowledge of contraception. The book was controversial, however, at the time, and Knowlton wound up having to pay substantial fines. The reissuers also, many of them were fined, and some of them were actually jailed for distributing this information. The Comstock laws also had a significant impact on the history of family planning in the United States because they prohibited the mailing of obscene materials, and contraceptives were considered obscene. That really restricted access to contraceptions until the 1970s when it was repealed. Margaret Sanger, one of the pioneers in the work of family planning, was one of the victims of the Comstock law, who was jailed for her work in promoting family planning. She opened the first birth control clinic in 1916 in Brooklyn, and that actually wound up sending her to Rikers. It's kind of a bizarre way to treat somebody who's trying to do such a positive thing, controlling fertility, but that's our history. By the 1930s, just a short time later, the American Medical Association came to endorse contraceptive medicine and family planning. Some major events on a historical timeline. 1960, oral contraceptives were introduced, the pill, followed closely by IUDs. 1967, the Trust Fund in the United Nations for Population Activities was established. So by the 60s, we're starting to see an international response to family planning. Again, not always with the goal of promoting women's autonomy, but certainly the focus was on fertility control. By the late 60s, Pope Paul VI issued a statement against contraception and banning the use of it as morally wrong, echoing Malthus 200 years earlier. And at the same year, Paul Ehrlich publishes The Population Bomb, reminding everybody about the concerns of population explosion and the need for population policy. And family planning has become sort of synonymous with population policy. Demography has been viewed as relevant to that. Now, historically, humans have been rather pro-natalist, really not seeing any need to control fertility, but the recent explosion in the last, certainly since the Industrial Revolution, has changed that. Advances in medicine and sanitation have led to longer lives, which has led to a decreasing death rate, and the fertility transition has needed to follow the epidemiological transition in order to keep population in check. The first family planning policies actually came out in the 18th century in Europe under the concerns of Stewart and Malthus about population explosion. Were the more pessimistic views, the Condorcet and Godwin, of course, offering more optimistic views. And since that time, we can see that debate has taken on new faces, but some of the same basic ideas. And that will wrap up our discussion of family planning and women's rights. Thank you for watching.